Good afternoon, everyone, and welcome. It's Friday afternoon, which means it's Fertility Talk. And today we are speaking to Dr. Tebogo. She is a director and fertility specialist at the Genesis Reproduction Clinic. Or is it clinic or center?
Center.
Center, yes. So Doc, we are very grateful always to have you. And with the specialists, I'm always saying thank you so much. I have to say thank you to guys, because I know your time is very precious and you guys are always fully booked. So it takes a lot from you to just step away for a little bit to have these talks with us, but to also educate the women out there that is dealing with infertility. So today's topic is something that it's everywhere at the moment. It's the lives we're living at the moment, COVID-19. And with the COVID-19, and especially when it comes to pregnant women, it's very important that we actually ask these questions. And the question is today is, when do we take the vaccine? Is it before you do the fertility treatment? If you are thinking of fertility treatment or trying to conceive, do we take it now? Do you take it in the first trimester? And that's a question we are asking Dr. Tebogo today. So thank you, Doctor, for joining us. And we're looking forward to hearing your expertise on this matter.
Thank you very much, Lee, and thank you for the opportunity to be able to share with South Africa at large about this very important topic, which is COVID-19 and reproduction. So why would we be interested to talk about this topic in particular? We all know what happened March last year. We went into a frenzy. There was lockdown, and this was as a result of the COVID-19 pandemic. And what this happened was that it led to a lot of postponement of cycles, and this caused a lot of anxiety in most of couples. And interesting enough, a lot of clients actually wanted to resume their treatment, as much as people would have thought that everybody would have wanted to crawl into their hole and be scared. But there was also a worry about whether this COVID would lead to effect on the reproduction system. Is the reproductive system at risk? And is there a possibility of vertical transmission? Meaning, could you pass the COVID-19 virus onto your baby?
Yeah.
So we're going to be tackling issues. So hopefully I'll tackle both COVID-19 infection as well as vaccine-related issues. You do have a choice as a listener out there, whether you take your vaccine or not, but I will take you through the pros, especially and if should you decide to take this vaccine, when would be the right time to take it, and what could be the predicament if you do not take it. So I'm not here in any way to be convincing you go take a vaccine, but to be information sharing. So what are the effects of COVID-19 on pregnancy? What we know is that if you are pregnant, as compared to when you are not pregnant, there is a more likely chance of getting a severe disease, and there is more likely chance of being admitted in ICU. And we've also started seeing that there's a higher risk of a thromboembolic phenomenon, and this has been found in both symptomatic and asymptomatic pregnant patients. So it's not just those who are COVID-19 asymptomatic. We've seen a decreased placental perfusion. We've seen increased placental inflammation, and some babies that were born to COVID-19 positive mothers had some infection themselves, and there's the possibility of indeed vertical transmission. That means that congenital COVID-19 is possible. And should you get COVID-19 infection during the first trimester, it is postulated that the fever that develops during that time may actually lead to long-term neurological defect or neurological problems of the baby. So what about COVID-19 on the reproductive system of the female? So far, we have not really seen any impact on the reproductive system. There's been some anecdotal discussions about whether the women who suffer from COVID-19 could present with increased bleeding during menstruation, but evidence has not actually proven this. Impact on an ovarian function has not been proven. No impact on follicular fluid during IVF. no impact on ovarian reserve. This is actually very good news.
Yeah.
And there's no long-term effect actually of COVID-19 of a woman. But the story is a little bit different when we talk about men. It has not been proven that COVID-19 can be sexually transmitted. So if the man is COVID-19 positive, there's no evidence that they can pass it on to their partner sexually. But COVID-19 infection has been shown to be related to reduced testosterone level. And this may lead to a sexual dysfunction, and also effect of the virus on the blood vessels of the penis can also lead to erectile dysfunction. There's been some evidence of reduced spermiogram parameter, but this is actually transient, so that is good news. And then there's also been some evidence of reduction in some germ cell production, or some form of germ cell destruction that has been seen on people who especially have severe COVID-19 infection. But having said that, we don't know whether this could be as a result of the infection itself, or it could be as a result of the treatment, because people who have COVID-19 infection are on high doses of steroids, and they are also on antiviral treatment. So these on their own could also have an effect. But we've seen viruses like mumps and Zika virus that have been found in testicular tissue and have actually resulted in destruction of the testicular cells. But so far, the spermiogram tests that have been done during a COVID infection and 60 days later have only shown a transient reduction in the spermiogram, which is in a way some good news.
Yeah.
What about the effect of COVID-19 on fertility treatment? So those who are on IVF. So we have not found any effect on egg retrieval. So if you are COVID-19 positive, there will be no reduction in the number of eggs or something like that. There has been a cycle cancellation, but this usually depends on the severity of the disease. So should you be COVID-19 while you are undergoing your IVF treatment, it is better to discuss with the clinician. And usually cycle treatment cancellation is as a result of most probably if you have high fever, because the life of a person will come first. But if the person is already triggered, that means that you've taken the trigger shot, it may be better to go ahead and do the aspiration. Or if you have at risk of hyperstimulation syndrome, it's also better to actually go and do an aspiration, but then go on a freeze or cycle, because we know that the transient fever that is associated with the active COVID-19 infection may actually lead to poor perfusion, and as a result of that, it may affect pregnancy rate. But so you may freeze both embryos or oocytes. There is no effect at all. There's been discussions about at what stage, whether you freeze at cleavage stage, which is day 3, or you freeze at blastocyst, but the jury is out on that one. So we know that the inflammatory state that you see as a result of COVID-19 may result in reduced pregnancy rate. And as I've already stated, in the first trimester, you may have some long-term neurological defect on the baby. So what about COVID vaccine and reproduction? So studies that have been done so far, so it's been about a year now that we've been living with this virus. So the vaccine, the studies, the evidence that is done, that is available, is fairly short. And it's been done mainly on the messenger RNA vaccine, which is the Pfizer, the vector RNA vaccine as well. And this has not been found to have any effect on the DNA of the host, and there has not been any evidence of expression of the virus in the person as a result of maybe receiving the protein, the vector. But there's been risk that has been increased, especially with the AstraZeneca, that has been seen to be related with increased risk of thromboembolic phenomenon with the strokes that we're seeing. And sometimes you may also have DIC, and the thromboembolic phenomenon is even more so in pregnancy, because pregnancy is a hypercoagulable state. Am I saying that you shouldn't take a vaccine during pregnancy? That's not what I'm saying. So in pregnancy, but there is both mother and baby protection. So the risk of getting the infection is much higher. The after effect of the infection is much higher as compared to the risk of the vaccine on the pregnancy at that matter. So let's look again at COVID vaccine in pregnancy. There's been quite a few studies that have been done so far, and there's been found that the side effects after being receiving the jab is similar to those who are not pregnant and those who are pregnant. And most of the time, the most common one is pain at the jab site. There's some bit of headache, some bit of myalgia, some bit of fever, but not as bad. So when you are pregnant, you are not more at risk of having side effects as compared to somebody who's not pregnant. There has not been any evidence of pregnancy loss if you receive your vaccine during pregnancy. No evidence of small for gestation, fetal anomalies, or fetal loss. And in the latest study that was done in the US, a third of the people who received the vaccine were actually in the first trimester. And this is interesting because we've been telling people to rather take their vaccine from 14 weeks onwards. But in this study, a third of them were actually in the first trimester, and there were no obvious signs of fetal anomalies. There has not been any evidence of increased miscarriages, but we know that if you receive the vaccine in your third trimester, there's a higher chance of neonatal protection because you find the antibodies that are expressed in the baby after the baby is born, as well as being expressed in the milk as well. So you've got a double protection effect. But so far, it is better to actually have the vaccine and protection against getting the infection in pregnancy as compared to not taking it at all. The only thing that we don't have is no long-term effects because, as you can imagine, the vaccine has only been around for a year. But having said, we also don't have long-term effects of the virus on the baby either. So at the end of the day, we will be looking at whether the effects that we will have, is it because of the vaccine or is it because of the virus? So it's one of those things that, a fire or a kettle, whichever one you try to avoid, you will still end up with hot water. So do we then say that should you take your vaccine when you are pregnant or when you are going through your cycle? We think that there is no problem with taking your vaccine when you are on your cycle because it doesn't have any problem. But preferably take your vaccine before your cycle. So pre-pregnancy vaccine is better. So there was a study of people who received their vaccine 90 days before, or so on either side, so before the cycle and after the cycle, and it was not found to have any negative effects. There was nothing like pregnancy losses or cycle cancellation or anything like that. So when should you take your vaccine? If you are planning to do your IVF cycle, preferably before you take your cycle, before you start your cycle. But let's say that now you were taking the two jabs vaccine, and now your second jab is during the time when you are during your cycle. You can take your jab because you've got evidence of what happened to you when you take your first cycle. But you can take your jab, go through the cycle, freeze all, wait and see, because should you get a fever or something like that, then it's better not to transfer, and then take a month's break, and then thereafter now you can come back and do your jab. So to come back and do your
treatments.
Embryo transfer and all that. So in general, we don't actually think that taking your vaccine during your IVF cycle has got that much of detrimental effect. So in summary, we know that there is no COVID-19 transmission by reproductive system, so it is not an STI. We know that there is no negative impact of infection or vaccine on the female fertility, but there may be some form of potential effect on the male fertility, mainly of the infection, not really the vaccine itself. We know that there may be increased risk of severity of the disease if the pregnant woman gets the infection, and there may be some form of potential of vertical transmission to the baby. And Vaccination is preferably better pre-pregnancy, but should you be pregnant, we know that it is also safe. You can also take your vaccine during breastfeeding. And if vaccination during cycle, it is okay to take it, but rather do not transfer. So far, we do not have any long-term effect of either the infection or the vaccine of the infect. Thank you very much.
Wow.
Any questions?
Yes, I just got one question. Does it mean when, obviously, if you are pregnant when you your first trimester and taking the vaccine, does it mean that your baby is automatically protected?
The question is whether the immunity will last that long. So the baby will be protected. The baby will be protected in utero, as in like your chances of getting a very severe disease, which is exactly what causes the viremia, the vertical transmission. But it does not necessarily mean that the baby will have antibodies once they are born, such that your baby will be safe post delivery. But during pregnancy, yes.
Okay. I don't see any other questions, but I'm sure there's always questions after. I'd just like to say thank you again for doing this talk with us. If anyone wants to get hold of Genesis, could you please give us your details of how they can get hold of you at the clinic?
Okay, so I am based at Genesis Reproductive Clinic, which is based in Kloof Hospital, which is in Erasmus Kloof in Pretoria. So if you want to get hold of us, you can get hold of us at our number is 012-367-4364, 012-367-4364. Otherwise, the email address is reception@drdeo.co.za, and our website is www.genesisart.co.za.
Okay, perfect.
And you can follow us on Facebook, and we are also on Instagram as _Deo. Thank you very much, Leanne, and keep safe, South Africa.
Thank you very much, Doctor. If you didn't get any of that, you can also find the Genesis Reproductive Clinic Center has a page on our website, so fertilitysolutions.co.za, and you'll also see a few posts that I do for them on Instagram and on our Facebook page. Thank you very much, Doctor, and have a great weekend. Thanks, ladies. Bye.
Thank you very much, and goodbye.
Bye.